Hello, welcome to our frequently asked questions. A common question that I get asked is, how do I avoid a pull facelift? How can I have a natural looking result? My name is Dr. Julian De Silva and I'm a London-based oculofacial, cosmetic and plastic surgeon. And this question is one that is relatively easy to discuss. A pull facelift is really where things have been exaggerated, the skin has been over-tightened and too much has been done. A natural looking facelift is one where the contours of the face are preserved, the natural features and characteristics of your face are preserved. And one way in which I determine this with every patient is ask every patient to bring an old photograph with them to their consultation. Because everyone ages differently. Everyone has different genetics and ethnicity, and it's a question of looking at how you individually or personally have aged in order to look at how to rejuvenate your face. A natural looking facelift is dependent on several factors. Choosing the right procedure, ensuring that your personal aging is remedied by the surgery, but also ensuring that any lifting of the facial tissues is done below the skin level. So where your face can drop, such as the jowls, where the cheek has dropped down, or where in your neck bands may have been caused by laxity or looseness in the underlying muscle, the platysma. Well, it's important that those underlying characteristics, those underlying anatomical features are lifted as opposed to just lifting the skin. Now, certainly in the past, like certain surgical procedures just involved tightening the skin. And although that was a much faster procedure, it gives you a more tightened and artificial look by creating too many stretch marks on the skin. And so absolutely key is lifting the areas beneath the skin, and that involves lifting the SMAS or deep plane facelifting. The other characteristic that is very important, keeping things looking natural, is hiding the scars. And although, again, like certain procedures can be done relatively quickly by making scars in front of the ear or in front of your hairline, those scars can be really quite visible after surgery. I personally will take additional time to hide those scars by using the natural contours of your ear, the natural hair that can cover the scars, and using your natural curves. This can make the scars relatively difficult to see even 6 weeks after surgery. I hope this answers your question and has been useful. Thank you.